Welcome to the clinic. For those of you who don't know me, I'm Dr. Holmes. And in today's video, we are diving into an important topic, colon cancer screening. And why now, you may ask? Well, March is National Colorectal Cancer Awareness Month. It's the perfect time to talk about this crucial topic, raise awareness, and break down everything that you need to know to help you and your loved ones stay proactive about your health. So, if you're ready to learn more, let's get started. Colorectal cancer is the second leading cause of cancer-related deaths worldwide after lung cancer. Colorectal cancer is most commonly diagnosed in people over the age of 50. However, recently there's been an increasing incidence of what we call early onset colorectal cancer being found in younger adults under the age of 50. The 5-year survival rate for colon cancer really does depend on the stage at which it's caught. For localized cancer, meaning cancer that's found in the colon or the rectum that is early stage, the survival rate can be as high as over 90%. There are several key risk factors that affect your risk, of course, for developing colorectal cancer. Your age, family history, diet, lack of physical activity, obesity, and smoking. Due to the increasing incidence of early onset colorectal cancer, the United States Preventive Services Task Force has begun recommending that people start getting screened at the age of 45. There are several different screening modalities to screen for colorectal cancer. I'm going to talk about 3. For the full list, check out my latest blog post at www.theimperfectmd.com. The 3 that we're going to discuss is 1, the colonoscopy, 2, the fecal immunochemical test, and 3, the stool DNA test, often commonly referred to as the Cologuard. So let's get started. So let's first talk about the colonoscopy. This test allows providers to examine the colon for polyps, tumors, or abnormal areas that just don't look right and remove any polyps or biopsy any abnormal areas if found. If everything is normal, nothing is found, everything's clean, and you're at average risk, then your next colonoscopy wouldn't be due for another 10 years. There are a couple of advantages for the screening modality. One is that truly it is the most comprehensive test because you have direct visualization of the colon and the tissue. 2, there's an opportunity for removal of polyps. There's the opportunity to biopsy areas of concern, and depending on the size and depth of the areas of concern, you can actually remove the areas of concern, and there's no need for any additional intervention other than a more frequent screening. Now, the risks associated with this screening are, of course, the bowel prep can sometimes cause electrolyte abnormalities depending on if you're hydrating and drinking enough. My patients like to tell me, and I've gone through it myself, that the actual prep is not the most pleasant experience. But it is essential to make sure that we get the colon as clean as possible so that way the tissue can be visualized without any muck around. Another risk associated with it, of course, is the fact that there is sedation involved, and that's always a risk, but it is a minor risk. So that's the colonoscopy. Let's talk next about the fecal immunochemical test. This is a stool test that looks for hidden blood in the stool. This test has to be done annually, and for me as a provider, I would say that this is a disadvantage. Advantages for this test are that it's non-invasive, there's no bowel prep or sedation needed, and it's a bit more convenient. The reason why I say that the fact that this test has to be done annually is a bit of a disadvantage is that in order for it to equal the effectiveness or to be considered as effective as it can be, as a colonoscopy is, it has to be done annually without fail. And sometimes patients will get lost to follow up. Things happen, like the COVID pandemic, or just life changes, and we may miss a year. And that's always concerning for me. But it is a modality that is possible. So, the next screening test that I want to discuss is the stool DNA test, which is also commonly referred to as the Cologuard. This test looks not only for blood, but it also looks for what I call cancer cells, or essentially abnormal cells, DNA markers that might suggest possible colon cancer or precancerous polyps. The reason that I do like this test, even though it does have a high false positive rate, is that it is very convenient for most of my patients to do in the comfort of their own home. Essentially, a kit is sent to you in the mail. There's a bucket, there's a test tube. You get your sample of poop, you send it off to the lab, and it checks your stool for cancer cells or abnormal DNA markers and blood. What I do tell my patients is that if it's positive, please do not go around telling everybody that you have colon cancer, because that's not what it means. What it does mean is that you definitely have to have a colonoscopy for further evaluation. Now, as I said, the disadvantages of this test is that it has a high false positive rate, which, when you're thinking about it, if you're screening for something, I'd rather have a high false positive rate than a high false negative rate. The other disadvantage for this test is that it does have a false negative rate, as does a colonoscopy, as does the fecal immunochemical testing. No test is 100%. But the Cologuard, or the stool DNA test, does have a bit higher false negative rate than the colonoscopy. For the complete details, again, check out my blog post for all the data. So, those are the 3 screening tools that I wanted to discuss. So, let's talk about you. Think about which one of these screening tools would fit your life. Schedule an appointment with your doctor, your provider, your nurse practitioner, whoever is the primary one that's managing your care. Sit down and have a really good discussion with them on what their thoughts are, and come together to formulate a plan on how you're going to get screened. Because screening is essential to be proactive. I think that's all I've got for you. Thanks.